Just in case, big dogs. They're big dogs.
A little out of pocket comment.
But yeah, no.
All right, you good.
So,
I think throw it there. That's fine.
all right, let's go. All right, yeah, it's pretty good. But yeah.
Oh.
And then, as long as we don't say anything too out of pocket, I'll leave it up.
Cool.
But they, yes. Wait, oh shoot, I had to take on the combine. But yeah, we can move to the next thing. I forgot what I was gonna say. I was saving it for the live, but now I don't remember.
Oh, I got you.
All right.
Let's just review your heel raises and toe raises.
Okay.
I'm gonna put sweats on.
Wait.
Weird.
Ha!
This is what PTs do at other places.
What you mean?
Just walk away from patients being treated.
Is that a no-no?
Technically, you can't bill for that.
Oh, really?
Correct.
That's...
Because your time has to be technically in person, like face to face with
Interesting.
the patient.
See, if I did walk away, I wouldn't report it.
Wouldn't come back.
Well, but yeah, what I was gonna say is, I think one of the biggest points of delusion us men have in general is our 40-yard dash times. That's always been something that's bothered me, is how fast people think they really are. Because I think what people do is they compare themselves to, like, the NFL Combine. Or, like, yeah, they compare themselves to pros. Where, like, the guy runs a 4.7, and then there's a bunch of dudes running 4.4s, and they're like, okay, that guy's slow. But in reality, compared to the average Joe, like, a 4.7 is freakishly fast. Like, if you're an average Joe and you have a 4 in front and not a 5,
Yeah.
you are a really, really good athlete.
Yeah, correct.
But, yeah, so that's just, like, people in high school have, like, their drunk coach with their stopwatch, clock him in at 4.4, and they're like, yeah, I ran a 4.4. No, you didn't run a 4.440.
No.
I would say 40-yard dashes, the ability to dunk a basketball, are probably the two things people lie about most.
I agree.
If someone could just touch the rim, then they will say they can dunk. I definitely said I could dunk before I could dunk a basketball. But
Well, I'm never going to say I can dunk, so.
all right, so what's next here? So,
Did you do these already?
oh yeah, I got a little distracted. Just 1 foot or?
Just 1 foot is fine.
Okay.
So, then
Yeah.
after we're going to do it standing up.
A little bit tight in this spot, but
In that
Okay.
inside spot?
and then yeah, a little. When I go up, I just feel it a bit, just a little tightness, but it's not really. I don't feel like it's really. It's not restricting my movement, but I do feel a little.
A little shakiness there, right? That's why it's important we got to go through the full range of motion when you're doing it.
All right. Yeah, and take my time probably.
Exactly.
Yeah, basketball players, man. I watched a video the other day about, like, NFL players who played in the NCAA tournament.
Yeah.
It's actually wild how many there are in, like, the last 20 years.
Oh, I can imagine.
Antonio Gates was really nasty in college.
Oh, yeah.
Elvid, Elstream. Thank you, buddy. How we doing? Okay, Retail Empire. I'm trying to remember who that is. Is that my center? Is that my center? We're back with the rehab here. Yeah, the first comment was Elvid, Elstream. That's all right. I think that's one of my kiddos. Is that Cole? Yeah, okay, that's Cole and Parker, my two big guys. We handled business yesterday. Let's go. Probably, yeah. We took care of business.
Oh, there you go. Did Cole have any chase back blocks again? Dude,
Cole actually did have another chase down block.
Did he? Oh
Yes,
my
he
gosh,
did.
That's nasty.
Yeah.
Nasty
Yeah,
stuff.
I know. Yeah, I know. Cole had a nice game.
I left my
Parker
seat.
fought through his ankle.
I left my seat. It was crazy.
But, yeah, fellas, don't lie. If you can't dunk a basketball, don't say you can dunk a basketball. That's one of my biggest pet peeves. And then don't exaggerate your 40 time. I was saying, all because someone clocks you in high school with the stopwatch at a time doesn't mean you ran it. These guys are all laser timed. That's my biggest pet peeve, and I'm trying. And then bench press. Everyone also exaggerates their bench press too.
True.
I would say those are the three things I say that us men exaggerate the most. We exaggerate our 40-yard dash times. We exaggerate our ability to dunk a basketball, and we exaggerate our bench press. Those are the three things that our egos and our prides just we take over. Like, I'll admit it. I said I could dunk before I could dunk a basketball, and I respect someone who's close and admits they can't dunk.
I can't dunk.
See, I
close,
respect that.
and I'm not close. All right, you go with those.
Okay.
Okay, I'll have you standing up now. We'll turn and we'll face the table.
Okay.
I'm gonna have you just go ahead and kind of come up on both heels or come up on
Calf
both toes
raises?
for me. Just calf raises like normal, okay?
Okay, I haven't done these in a minute.
Hey, there it is. Look at those beautiful calves. Those thick Achilles.
The Achilles is tight.
What did he say?
Over here.
There you go. Have you ever worn inserts, Matt?
No.
Oh. Got some flat feet, my dude.
Yeah,
There you go. Does it feel all right?
a little tight in the left Achilles.
Well, you are working that area, which is fine.
Yeah, take some time, I imagine.
Yeah. All right. When you're done with like 10, 15-ish, we'll do toe raises, just standing.
Okay. Right. You want this? Which way?
Either way is fine, honestly. No preference. That was going to be weird.
Knees over toes guy's a big fan of these.
What's up?
Knees over toes guy.
Who's that?
You don't know knees over toes guy?
No.
The guy who does all the exercises with his knees over his toes, like lunges, squats.
Oh.
Yeah, he's a big fan of toe raises or tib raises.
Tib raises for sure.
Yeah. Bulletproof. He's all about bulletproofing the knees.
Bulletproof your knees.
By bulletproofing the knees. And
That's a real thing.
I'm a believer. I'm a believer.
I think it's important to have strong knees.
But his vertical jump is insane. And he had like chronic knee problems, and he also like was an average athlete, and then he's created this workout program, and he's bouncy out of his mind, and he's had a lot of people follow his stuff, like do things that they've never done.
No, that's fair. I bet I could run a 4.8. I think in college I ran a 5 flat.
That's a good time.
Great.
No, 5's a good time for a lineman.
Yeah.
For an offensive lineman, that's better than a lot of these guys will run a 5 flat.
I could not run that now. But
A 5 flat's actually really good for an old lineman.
I think when I was in like 7th grade and we had to do it, I was like a 6. I was like, that's weird.
Honestly, 6 is pretty fast for a 7th grader.
I don't know about
lineman.
that. I was a chunky kid, man. I was carrying a lot of weight.
All right,
so now you're going to put essentially your heels together, and you are going to squeeze this little smiley face ball between, and then you're going to come up heel raising down, okay?
All right.
So that's going to get the inner part of the ankle muscle in the posterior tibialis, where you've been kind of saying that you've been getting a little bit of that pain sensation.
Yeah.
That's going to help to activate it, along with kind of raising up the calf just to help stabilize the ankle. Can help to kind of work that out as well, okay?
Yeah, it's funny. I
on the
don't.
inside.
Yeah, I don't feel the tightness in the Achilles as much.
Gotta get a shot of the feet there.
It's okay.
There we go. Oh, I'm messing around with it too much. You can see the feet.
Let's see what I'm doing.
Give us a room tour. I don't know about that one.
Yeah. How many do you want me to do?
15 to 20.
Okay. I gotta remember, take my time.
Yeah.
It's also like lifting weights, like, you want to just get as many reps as you can, but you probably should take your time and get a good stretch of the muscle.
Yeah.
All right, that was 20.
Good. Okay. Then I'm gonna have you kind of do the same thing with the kind of rotating the foot in and out. but in the standing position now. So again, watch the knee position, right? You're just gonna rotate
Okay.
in, and then rotate out, just standing.
Wait, should my feet be like level?
Yes.
Okay. So this in. How many you want?
We'll go 15 of those too, but watch the excessive hip motion there.
Okay.
Especially on the inward. I don't need you developing like a groin problem,
Okay. That feels good.
Good.
I like a little bit of like I like when I feel it working.
Yeah.
It means it feels like I'm doing something
That's
productive.
good. Oh. We never talked about the Wisconsin fumbling the bag against Oregon. That was pathetic.
Yeah, I talked about it on the channel. It was.
Did you?
Yeah. It was bad. It is what it is, but hopefully they can learn their lessons and.
98.9% chance to win.
I know.
7 minutes left. Gotta love that.
But rather now than the tournament. Rather now than
Yeah,
the tournament.
yeah. We don't want another James Madison situation.
Yeah, I don't think that'll happen. This team's a little different than last year's squad, and you don't have anyone who's pulling an AJ Store that we know of who's brokering their services in the middle of the year. Because I mean, most of our team is seniors outside of maybe Blackwell and Winter, but I don't think they have that Store in them. Hopefully they don't.
True. Tanjay, join the pod, bro.
I know. I reached out. I reached out before the season.
Stop playing with him. Join the pod.
Because Tanjay's definitely watching this stream.
Like and subscribe.
Yes, sir.
We gotta get this to John Tanjay. At John Tanjay. Join the pod.
All right, big dog.
All right, nice.
What next?
Squats.
So
Or let's just hit the stands first. Hit the stands first. Even foot position here. Shift your weight forward, knees over toes, and then back down. Weight in the full foot. I don't want weight on toes. There you go.
Okay.
How's it feel?
Good. How many?
We'll go 15 to 20. Free PT, nothing like it.
Yes, sir. Yes, sir.
Physical therapy for sprained ankle.
Yeah. But yeah, Mike, you want to give an update to how the ankle's doing compared to what? I was here 10 days ago, maybe? I think 10 days ago.
Well, do I have your consent?
Oh, yes, yes,
Okay.
yes.
All right. You heard it here, folks. I have verbal consent. So yeah, Matt is 15 days out from his ankle sprain. Swelling is extremely reduced compared to the last time we streamed this live. Motion has improved greatly, especially into dorsiflexion and plantar flexion, where you bring the foot up towards your shin and then point it down, kind of pushing on the gas pedal. He has very close to normal motion when you go inward and outward with the foot on both sides, which is great. So that's a great improvement there. Progressing more strengthening kind of for the lower leg and calf muscles today, just to essentially kind of get you back to doing or preparing for running and jumping and hopping and sprinting and all those activities that you're going to need to do towards the end of March there. So progress is very good. Strengthening in the ankle is coming along very nicely. But now it's time to get to more functional motions. Again, 15 days out. This is pretty impressive, in terms of the grade 2 ankle sprain that we said it was initially, or that the doctor said it was, I should say. Normally you don't necessarily see the bruising coming down as quickly as it does. I'd say that, probably is more around the 3 to 4 week mark when you start to see the bruising really subside, and we're already seeing it now. So definitely ahead of schedule in terms of healing process overall.
Some music to my ears.
This is great. So we're going to work on some sit back squats now.
But real quickly before, I've been doing his exercises. He gave me probably 10, 11 exercises to do.
Yeah.
And then I've also been, so when you sprain an ankle, the phrase and probably other or the acronym is RICE, rest, ice, compression, elevate. And I've been doing that. I've taken it easy on the compression. That's been the most painful thing about this ankle. And you guys can take, this is what it's looking like. It's quite a bit better than what it was. Still some bruising, but the foot's a lot less fat. But the compression sock, it hurt so bad putting that sock on.
Yeah.
Like on the foot, it hurt really bad. But I haven't done that one in a few days. I didn't feel like going through the pain, and then it takes forever to kind of strain out all the little things. But that did serve its purpose. But yeah, rest, ice, compression, elevate. I've been doing that, and then I've been doing his 10 or 11 exercises every single day, and that's why I'm ahead of schedule. So shout out to Mike, and yeah, you gotta do your part. You gotta do your part, and hopefully I can. Hopefully I can push the timeline a little bit and then be healthy when I do come back. But yeah, what's next?
We're going to do some sit back squats now, essentially kind of keeping you right back on your heels, touch your butt to the table, and come on back up, okay?
All right.
I think the biggest reason that you have success is obviously doing the motion. I think too many people wait to start moving after an ankle sprain, and that's kind of old science and old research where there was a school of thought back then that said, only rest, ice, compress, and elevate for like 4 weeks, but then you would obviously have patients and people that would have extended rehab stays essentially in physical therapy, right? The new science or the new model essentially says like get that thing moving as soon as you can. Work on swelling and reducing obviously any type of increased fluid in the joint as fast as you can, and bruising too. And then we've seen that has led to improved outcomes and shorter rehab times overall. So
one more. But yeah, and then what are your thoughts? The doctors wanted to put me in a brace, and I said no because a few years ago on this ankle, I think 4 years ago, I was playing pickup basketball just down the road here, and they were like these 2 7-foot twins playing who were both pushing, like 300 pounds. They're big dudes, and one of them like going for a rebound and tried poking the ball out from behind. And my foot got under him. He stepped on my foot, ankle turned under him, and that one hurt more than this one. That one really hurt. So when I did that, it ended up being very similar, I think, in damage to this one. And when I did that one, I only did an ankle brace. I didn't put the boot on. They told me just to do an ankle brace a few years ago. I listened, and haven't, knock on wood, I haven't any problems with this ankle. It feels great. And then this one, the doctor wanted me in an ankle or a boot on my foot, and I said no, I'll just take the ankle brace. So do you have any thoughts on for this, a brace versus a boot?
I think a boot, really I would recommend the boot use for the grade above what you had done when you have kind of a complete tear and rupture of those outside ankle ligaments, right? Again, a grade 2, we're talking about 50%, greater than 50% tearing kind of in those ankle ligaments there, right? So you can either really go back and forth, right? Typically, it's very patient specific and patient dependent, right? Some people like feeling more stable kind of in the boot, but there are drawbacks to that, right? So like the boot is going to kind of put you in a more dorsiflex position, right? And again, over a period of time, of wearing the boot, again, probably even 2 to 3 weeks time, right?
Yeah.
You can have increased stiffness, you can have inflamed tendons just as a result of not moving. You can have joint mobility deficits as well, and just kind of overall atrophy of the lower leg too, if you don't necessarily kind of rehab it well or strengthen it well, right?
Yeah.
So I think going this route, especially with Matt, who's more athletically inclined, has been good because obviously, you haven't suffered any type of significant atrophy. Again, your motion is looking really good. 15 days out from a grade 2 ankle sprain. The swelling is way down too, and you're not necessarily dealing with joint stiffness or muscle stiffness that we would normally see, right? Matt shared with me that he tried to do a calf stretch before and he didn't even feel a stretch in his calf. I can guarantee you that if you used a boot or if you wore a boot, you would be feeling that stretch 15 days after performing or 15 days after kind of having an ankle sprain. So again, very patient specific. I always tend to, I would say go more with what the patient prefers, obviously, but then, tailoring care and tailoring treatment to that specific patient. In this case, the brace was the good fit, right? So, because let's be honest, at the ortho, urgent care clinics, they don't necessarily know Matt the person. They see Matt the medical record number. So
Yeah, no, it's
It's
fair.
very, very patient specific.
Yeah, cool. Alrighty, so what you got for me now?
Yeah, so next one I'm actually going to have you kind of on the chair here. You're going to essentially kind of kick your left leg up on more so the chair. Gotta get the view here.
Right.
And then again, you are going to essentially kind of push your knee over your ankle, just like so. Kind of getting that dorsiflexion stretch, that Achilles stretch,
Yep.
more so kind of from the ankle there, and then you're going to back off it just like so. Okay, just kind of using more so the knee to do that, right? You can bend as much from the knee as you want. The minute you start to feel more so your heel raise, I'm going to have you come on back.
Right.
So right about there.
Kind of bring it back.
Yeah, but you can straighten it out too if you want. So like extend the leg back further when you come back.
Okay, like this.
So even first, so like,
So I step back a little
there you
bit.
go. There it is. Good.
Right.
Because then you're getting the plantar flexion motion and the dorsiflexion motion. Good. Typically, this is going to be called a knee flexion stretch. However, it could be used for ankle rehab as well. I use it all the time for ankle rehab. So
How straight do you want it?
I'd say that's fine.
Right.
Yeah.
And then keep my foot flat the whole time.
Yeah, I'd say keep the foot flat the whole time. Because in the minute that you lift the heel up, you're not necessarily getting motion anymore at the ankle.
Okay.
Is it the chair?
No, there's no problem.
Is that the guy? Is that Mason Taylor?
Oh, is that the tight end?
I think that's the tight end
Okay.
for NCAA. It has to be.
Yeah.
Yeah.
Oh, look at you.
Yeah.
It's too bad Lacey's in jail.
Oh, well, rest in peace. He's still alive.
Well, his life might be a little toast.
Yeah. Henry Ruggs 2.0. Look at that.
I know, he should have went to Georgia.
She tied in you. All right, let's go 5 more.
All right. Holy cow. Look at that guy with the mustache.
All right, go ahead, relax. Nice job. All right, perfect. Okay, next one I'm going to actually have you do for me now is some toe walks. So you're going to come up onto your toes. You're going to take 1, 2, 3 steps, and then backwards stepping. Okay.
1, 2, 3.
Good. We'll do that 10 times.
What about when I return? Is it alright if I put my heels down? Or
Yeah, you can
try to
reset.
stay-
You can
Okay.
reset at the end of every rep there. So.
We got 3.
What was the score of the game yesterday?
We won 38-22.
Nice.
Yeah.
Wasn't even close.
No, and it probably could have been more. Probably could have been a bigger dub, but we took care of business.
There you go. There you go. All right, let's do the same thing now, except you're going to be kind of standing on your heels. Your toes are going to be in the air, and you're going to take 1, 2, 3 walks forward and just turn around and come back. I don't want you to heel walk. You don't have to heel walk backwards.
Okay.
That's going to be strange. And I think that'll be it after that.
Cool.
I could do that. Oh, that guy sucks.
They all look a little awkward with this sled.
Oh, see, that's what you want right there. That's what you want to lift. You want to stay lifted. Oh boy. Oh no. Oh no. Oh yeah, that's what you want. Yep. Wide base.
Yeah,
Always have
we
the wide
have
base
sled
on the
pushing
sled.
on the TV.
Look at that. Nice. Good form. Oh, he runs back. Wow, competitor. He's going number 1. No, he's a tight end. He's not going number 1. All right, that's
big
it. Very
dog.
good.
Is that it?
That's it.
Alrighty. That was physiotherapy touch. You know, got some clips out there, or got some video out there, which is you know, a necessity. Try to be more consistent. Don't post for 14 days, and then YouTube doesn't like me too much when I do post again. So, got something up. Yeah. I think that's all I got. Probably gonna wrap it up here. But yeah, it was an interesting day in the world today, though, for sure. Anyone watching the news, is an interesting day. I feel like today, your reactions to what's going on in the news is a good gauge to where your testosterone levels are at, based on your reactions to the events of today. So, I someone disliked it as soon as I said that. But yeah, thank you very much for stopping by, and yeah, more stuff coming your way. I'm going to return. You know, I'm doing my PT, so I'll return to the one-on-one series. Got some people I have planned to hopefully will step up to the plate. Some interviews, and yeah, maybe some other stuff in the cards that's outside of the realm of what I've been doing. So stay tuned. Appreciate you guys. Have a good night.